canal is a way to save a tooth where the nerve has gone bad in the tooth. So, if you unfortunately have ever had a toothache, a lot of times that is because the nerve has gone bad within the tooth. And so the example I use is your tooth is like a tube. And so a root canal is we're going in there and cleaning the inside of the tube out. And then we, once it's all cleaned out, we seal it back up again. So a lot of those I feel like come from, when a tooth needs a root canal, a lot of times that tooth is really hurting you. And so sometimes it is a challenge to get you numb, but we do have technology and ways of making sure that that tooth is numb before we start, working on that tooth. I think, modern technology, again, has made the root canal process a lot more streamlined. We have our CBCT that will take a 3D image of that tooth so we can see right where the nerve is or sits within the tooth. And it makes it a lot more predictable. We can be in and out of there a lot faster, save you time. Saving the tooth is always preferable than taking the tooth out. As good as dental implants have been, having what God put in your mouth in the first place is going to be a lot more successful than anything that we have here in the office. A root canal process is very similar to a filling. It is a bit of a longer appointment because there's a lot more precision that's involved with it. But we actually have a lot of patients fall asleep during them because they have a bad rap, but they're really not that bad. So we'll isolate the area, we'll clean up any decay that would be in the tooth, and then during the process as we're cleaning it out, it's usually pretty easy for you as the patient. Another advantage for root canals is it's going to get you out of pain. With that nerve that's in there that's inflamed, a lot of times it is causing quite a bit of pain for you. And so a root canal is a really good way to get you out of pain and save the tooth.